Hello and welcome to Various Views on TIN TV. I'm your host Ramona, and today I have Cohan CEO Dr. Asadpour. Welcome, Doctor.
Thank you for inviting me.
You're very welcome. I mean, we've heard so much about Cohan, and of course, I myself have gone to a lot of the Cohan events and been a part of, as a part of the board and helped out. Tell our viewers more about Cohan and what it does.
As you know, the aging is a big problem for Canada. Right now, we have around 5 million seniors, and it's going to be 9 million in next 2 decades. And lots of seniors have at least 2 complaints, such as the heart disease or arthritis or osteoporosis and something like this. And so for that reason, this aging problem and also non-communicable disease, this is the picture of disease in Canada. We decided to have a charitable organization a long time ago to establish in Toronto with some of my friends. They are physicians and they are social activists to take care of this problem and then to be involved to address these kind of needs of the people. So for that reason, June 2009, we established this organization, Cohan, which is Community-Oriented Health Advisory Network, established 2009 as a non-for-profit. And our goals are health promotion for everybody, disease prevention for middle age, and chronic disease management for seniors. In May 2014, we got the status of charitable organization. And right now we are working on a non-communicable disease, mostly and primarily for seniors.
Absolutely. I mean, just recently, seniors are a bigger population than the youth under the age of 14 years old. So it is a big issue to address in Canada. But tell us about the Montessori method for seniors. What is that exactly?
Montessori method, as you know, is a teaching method developed by Dr. Maria Montessori. She was an Italian physician long time ago. And this method concern on individual and the environment, which is very important to take care of each person, each individual, and also the environment could be fitted and could be comfortable for that individual. And the main concern of or main basic factors that they think about it for each individual is the interest, needs, skills, and interest, need, skills, and ability. This is 4 major things that we should consider regarding the program that we have. This is the basic issues in Montessori for methods. For seniors. And the main thing is recently Dr. Cameron Camp, he's an American physician, and he said that there is some connection between the Montessori method as a tool, as an effective tool to address the needs of the patient that they have dementia, different kind of dementia. So after that, he wrote the books regarding that, and after that they call it the Montessori for senior because they use this method as a teaching method in dementia for health education and also to teach different kind of the lifestyle for the seniors.
Yeah, I know we were very busy. Cohan was very busy last year with many sessions, multiple, I think around 14 sessions where seniors came and were able to go through the whole process for dementia training and Alzheimer's specialization. So there was a partnership with Ontario Trillium Foundation with funding. Tell us about how that went and
That's right.
how the funds were used.
Yeah, fortunately, last year we asked the Ontario Trillium Foundation for help to support this idea, Montessori for Senior, which is very new in Canada, in Toronto, to test it for seniors that they have a dementia problem. And because, as you know, those people that they have a dementia or Alzheimer's disease, they're going to be isolated from the family, isolated from the social activities, isolated from the communities. So for that reason, to take them to have a meaningful social activities, and then to be meaningful engaged in the community, in the family. So we should work with them regarding the dementia and the other problem that they have, to bring them back to the community, bring them back to the family and every places, to be more active, and then also to somehow to prevent the dementia if they don't have it yet, or some people that they have it, to stop the to be worse, those diseases that they have. So for that reason, we got in this project that the Ontario Trillium Foundation funded $64,500, and then we got the 60 people from 350 seniors that we have. They were interested to come to this program, and we developed the curriculum, educational curriculum with the 14 session, 4 session as a general session or general topics, let's say brain structures, and also the Alzheimer's disease and other kind of dementia such as alcoholism, Parkinson's disease, depression, or some other things, and the other topics also for the principle of Montessori methods. What is that? So the first few topics we talked about those sessions that I said, those issues, and then the 10 session we had and we have for practical life, because in the Montessori method you have to talk with the people that they have dementia, with different ability, different needs, different interests. They have to be in the same or different groups to work on it, and then so we did it 10 session for that, and we had a very, very good result from this project that Ontario Trillium Foundation funded.
Right, because you did follow-up surveys where you called all the people who were part of the program to see, if their needs were addressed. I also understand that their care providers who take care of them at home were there to also learn how to manage to deal and take care of somebody who suffers from these incurable diseases.
Exactly, because in this project we have two survey. One survey, we call it program evaluation, to know how was the effect of this training for the clients, and also the other survey was outside of the our client, in the general population in York region, to talk to different seniors and different senior station or senior places to know what kind of the services they needed, or what kind regarding the dementia, and they like this method, they like the Montessori for seniors. If they like it, how they can contribute. So we got a good result. The result is the social engagement was 36% before program, and after that we think is going to be 56%.
Wow, that's quite
which
an increase.
Is very good, and also lots of people, maybe more than 90%, they believe that this program they needed, and then they would like to continue with this education. And also with the other survey that we got the result that the people, the seniors, they needed these kind of services, but not to come out in some places like Cohan places. They would like us to go there,
Oh,
to
wow.
go to the senior houses, to go to senior centers, to bring these services over there, and then they really appreciate if the government contribute or has contribution, because they don't have any money to contribute, but they need it and they like it. So this is the result of the survey. And the other thing that it was unexpected, we got a 24% of the people that they attended to this program has some kind of dementia problem or cognition decline. So, which is very important. We found those people, and then we have to work with them. I mean, they are about 22% in different kind of the problem. So, I mean, dementia problem. So we are working on it also.
That's fantastic. With we know that there's a drain on our healthcare system and to provide services for seniors. So it's great that organizations like Cohan and you having the vision to reach out to senior citizens who are suffering from incurable diseases or learn how to manage them and also prevent them. It's a great cause, because not only do you help your own citizens as in terms of senior citizens, but also helps, take the heavy weight away from our government offering these services. So thank you for having the
Thank you very
vision,
much.
and as the founder of Cohan and the CEO of Cohan, and how nicely you've put a board of physicians and doctors together, and as well as we have a registered nurse as well who helps out.
Yes, we have. Yeah.
So this is fantastic, but also it's exciting to know about the mobile services to be able to go to the senior citizens. I do want to mention to you guys that this service is absolutely free for senior citizens. They're not charged by any means,
Yes.
and they just participate. And what we do is we let them know in advance when the sessions are being held. We call them all, and then we also send them another call to remind them with your voice that the sessions are being held and for them to participate.
So thanks a lot for Teen TV, and also thank you for the people that they look at our program and then they follow that. And also many thanks to Ontario Trillium Foundation funded this program, and then we got those results, and then we test this Montessori for senior regarding dementia. Thank you.
Thank you, Dr. Asadpour, for your time today.
Thanks.